I would like to turn it over to Representative Khanna, who serves the 17th District of California in Congress. And the 17th District encompasses the cities of Cupertino, Fremont, Milpitas, Newark, San Jose, Santa Clara, and Sunnyvale. Welcome, Representative Khanna.
Thank you, Wendy. Thank you for your work, and Tom Pike and others for putting this together. I'm honored to be on with my good friends, Senator Bob Gwykowski, who's doing a terrific job representing our area in Sacramento, and Supervisor Otto Lee, who's doing an incredible job bringing new ideas and vision to Santa Clara County. Our focus, I was just back home and got to go to Levi Stadium and see the phenomenal job that the county of Santa Clara is doing, along with the 49ers and the city. I think they're going to get up to almost 15,000 vaccinations a day, and I think it's actually the most high-tech site in the country in terms of mass vaccination, and also got to go to the Mission ROP, where we had the Bay Area Community Center doing great work in getting vaccinations in Fremont and other parts of Alameda County. I understand that the critical issue is the supply, and Zoe Lofgren and I are working with HRSA to get more vaccines to our qualified health centers. We've gotten a couple of them qualified. We're trying to get more of them qualified. And then the hope is that over the next few weeks, the supply in general to the state improves. Of course, we've done, as California, we can be proud that we have some of the lowest positivity rate in the country, and we need to just keep getting our folks vaccinated. The good news is that the equity in the state has really improved. It's really working, the focus on targeting poorer communities, lower income communities, and Black and Latino communities. The numbers I've seen are showing greater and greater inclusion in who's getting vaccinated, which is very encouraging. The final point I'll just make is to thank President Biden. The American Recovery Plan provided $1 billion that we were able to secure for our area, hundreds of millions of dollars for Alameda County and Santa Clara County, and each city got 20, 30, $40 million. And now we're going to get to submit 10 projects for infrastructure and 10 projects for community needs. It's just night and day working with President Biden compared to President Trump. And so we're going to be able to help address the recovery. So I'm looking forward to continue taking folks' questions, and just want to thank the extraordinary local leadership. I'm really blessed to represent a district where we have fantastic leadership like Otto Lee and Bob Gwykowski.
Thank you, Representative Khanna, for that fantastic update from the federal government. I'm heartened to hear that some money is coming our way. Certainly that is a sigh of relief for many of us that are working in local government. Next up, I'd like to introduce Senator Bob Gwykowski. Senator Wieckowski proudly represents the 10th Senate District in Sacramento, serving residents of Santa Clara, Milpitas, Fremont, Newark, Union City, Hayward, and Castro Valley. Welcome, Senator Wieckowski.
Well, thank you, Wendy, and good evening, everybody. It's great to share the stage with Representative Khanna and Supervisor Otto Lee. As the Congressman indicated, the numbers on COVID-19 certainly look good for the county and for the state in general. The positivity rates are getting lower. Increasing rates with vaccinations are great. I think we all need to emphasize is, the weather is, turning much warmer. People want to be outside. There's that tendency to let your guard down, and I think it's good to remind folks that we need to keep our masks on. We need to maintain our social distancing. As horrible as it is that everybody is sick of it, we still are not out of the woods. I think that the governor and the legislature so far, in California, statewide, we've given 22 million vaccinations as of Fridays. The positivity rate, not only in the Santa Clara Valley, but throughout the state, it continues to look really well. But as the Congressman indicated, there is these inequities that are occurring, whether there's access to healthcare or access to the broadband to get their things. It's clear that the pandemic has highlighted that and drawn a greater concern. But I think leaders in the southern Bay Area and around the Bay have, worked alongside community-based organizations. That's sort of been the key, the nonprofits and the small businesses that have pressed the governor and the whole administration to really increase the equity distribution of the vaccinations. And some of the hardest hit communities in Santa Clara and in our region have really benefited from it. I mean, our former supervisor, Dave Cortese, has been a leader. There were like 15 Bay Area residents that pushed the governor to give $1.5 million to hire workers to do outreach into the community. They know whatever ethnicity you are, religion you are, we know the high vulnerability, the high risk folks that just were having problems reaching them. So the state's partnering, which is what we want to see. We have a partnership with the local communities and the counties to make sure that these low income areas and people that are at high risk are getting a chance to get the vaccination, and we're getting the word to them. And I appreciate all the work, as the congressman said, all the work with the local leaders on the ground that are doing that. Now, everybody's obviously has heard about the governor's blueprint for a safer economy. We're going to go beyond that on June 15th, and we're going to open it up to all people, or I guess, or we're done. We're free from the vaccine or the restrictions. Maybe. Obviously, we're worried about the availability of the 16-year-olds and older who everybody gets vaccine if they have an opportunity, and we have to see what those numbers look like. And secondly, the hospitalizations need to remain stable and low. So those are that, but it's a good path. I know that we're concerned with the manufacturing snafu that J&J had, and we know that next week we're going to have, or this week when we open up to 16-year-olds, we're going to have less vaccines available, and maybe the week after, but I think we're on a trajectory. Little bit about the relief package that the state does, because the federal government has done a wonderful relief package. We have our own state stimulus package, which was $7.6 billion. And that's in the form of stimulus payments. If you're, there's a California earned income tax credit. So that's a one-time $600 check. So you can get your $1,400 check from the federal government and get a $600 check from the Golden State stimulus program. And then families and friends that qualify for state programs or federal relief like Cal EITC or CalWorks, CalFresh, small business grants, and federal PPP loans, they can benefit from the February package. There's still money available. And we extended the small business grant program. That's not a loan. That's a grant to businesses, either $5,000, $15,000, or $25,000 grants if you have receipts of less than $2.5 million during the year. So I encourage any small business that has obviously been adversely affected by the virus to apply for the grant. And we know that we're trying to get more money to landlords and tenants as we've extended that moratorium and trying to offer landlords a deal that they're going to be taking. And that all gets wrapped up in our budget that we're looking for 2021-2022 season. So more to come, and by June 15th, if we're lucky. So let's stay vigilant and continue the fight against the virus. I look forward to the questions also.
Thank you, Senator Wieckowski. Certainly heartened to hear about the state's relief package. I know it is going to bring a much needed relief, really, to many of our residents who are hurting right now. Next up, I'd like to introduce Supervisor Otto Lee, who represents District 3 on the Santa Clara County Board of Supervisors. District 3 includes the San Jose neighborhoods of Evergreen, Berryessa, and Rosemary Gardens, the East Foothills. Also included in District 3 are the cities of Milpitas and Sunnyvale. Welcome, Supervisor Lee.
Thank you, Wendy. This is Otto Lee. I'm honored to be serving alongside our awesome elected officials like Congressman Khanna and also Senator Bob Gwykowski. And we are certainly a very fortunate place here in Santa Clara County of how well we're doing comparing to the rest of the world. As we can see, we are now down in the orange zone, and we are hoping that as things are doing better, we might head to the yellow. Uh, why is that? I mean, let's look around the world, right? We're looking at Italy, France, and Germany. These countries actually, as we speak, are actually shut down. And the reasons because their vaccination rates, unfortunately, is only in the single digits. And where we are is really amazingly different compared to what some of these even very advanced European countries is doing. So some interesting numbers I want to share looking at our dashboards. We have given, Santa Clara County has already given over 1.2 million doses, 1.2 million doses of the vaccines. And we have now ramped up to a capability of, on an average, 18 to 20,000 doses per day. Okay, that's a daily number. As of now, over 750,000 of our residents, 754,000 people, 16 and over, has already received at least one dose of the vaccines. That represents close to 47% of our population, 16 and over. And of those, 436,000 has already received the full vaccination of both doses or the one Johnson Johnson, which is one and done. So at this point, over 27% of the Clara County is already fully vaccinated. These are phenomenal numbers. And I would say no small thanks to our awesome county staff that has been really putting all this together, from Dr. Cody, Dr. Fensterscheib, you get to listen to later today in our panel, and all the great help that we've received from the state and also from the federal government, because all these vaccines coming to us is from different area. Even though they all allocated from the federal government, at the end of the day, it really is allocated from the state. And I'm really heartened to say that our county staff has really stepped up since December, as soon as the vaccine arrived in our county, to beef up this capability. The data is very clear. We still have a lot more to do, but this ramp up is exciting. As Congressman Khanna has mentioned, the FQHC, the federally qualified health clinics, will be getting direct allocation from the federal government starting this coming week. And we have actually requested over 300,000 doses on a weekly basis. And that just came in, and we're waiting for those good numbers to see, because certainly we can then at that point ramp our number up to 25 to probably even 30,000 doses a day. And this is just the county, not counting our other partners. And when I say partners, we have our Kaiser Permanente, Palo Alto Medical Foundation, PAMF, and the VA Palo Alto Health Care Center, CVS, Walgreens, even Costco and Safeway now, those retail pharmacies, all those are getting them in a different allocation as well. So you could see that we're very likely to be able to get over 300,000 doses a week if all working out. So I'm really excited to see these new numbers, because when you do the math, even the 250,000 doses a week, we are talking about 1 million doses a month. Just think about it, 1 million doses we're able to give out in a month. So those are some astronomical numbers, which is great, and that shows how much work that we have beefed up to where we are right now. And back in March, we were actually quite concerned. The data was showing that the Latinx and African American community has not been getting the same percentage of vaccination as it needs to be, and those are the most affected communities, as we have seen. And since then, the county level, both myself and Supervisor Cindy Chavez have co-sponsored a referral to come up with a utilization plan for a vaccine to go across the different communities to achieve the parity that's so needed through data. And from that data, we've been able to open up so many more new sites in the east side of San Jose, where it was the most hard-hit. And there's now the Stanford Health Clinic is running the vaccination site over at the Eastridge Mall. Extremely popular, extremely excited, and there are a lot of lines, and people are very happy of it being there. In our own district, we have the East Valley Medical Clinic, Emmanuel Baptist Church, is actually one of the highest number of advanced signups. And of course, in addition, we have been putting a lot of these mobile clinics and pop-up sites all over the county, and especially on location where we know a lot of our vulnerable communities were. So last week I was over at the in Sunnyvale at the Columbia Neighborhood Center, and we are able to vaccinate 500 folks who some sign up ahead of time, but a lot of them actually did not even sign up. It was just a walk-up site, and all 500 were used up before the end of the day, serving a lot of our Latinx community in the Columbia Neighborhood Center. So these are the type of work that we're doing locally, trying to make sure that the vaccines get to those who are most needed. And I'm glad to say that the acceptance rate has been extremely well. That being said, we still have a lot of work to do. One of the issues that we do see a lot of social media issues where people still have a lot of hesitancy of the safety of the vaccines. And I can't reiterate more about the issue, is that those 3 vaccines that we have, whether you're talking about Moderna, we're talking about Pfizer, or we're talking about Johnson & Johnson, those 3 have gone through the FDA very thorough process. Even though it's fast, it was a very thorough process, and that the side effects that have been mentioned are very, very small. I know a lot of times when we read those TV commercials of a new drug, the side effects are like half the ad, and after you hear all the side effects, you say, I don't want anything to do with this drug. Well, in many cases, I think a lot of people hear too much of side effects. The numbers are very, very small, very mild. Myself, I have got my first dose, and my arm was sore for about a day or 2, but it's very, very mild. And my parents, my in-laws got them a few months ago, and that's the same report I'm getting. So I'm telling people, so far my personal experience, it's been very safe, and I absolutely want to advocate people, do not wait around. You know, this is not something that you want to wait. This is the one that when you're eligible, please go get started. And guess what? Starting this Friday, the 16th, anyone over 16 years old will be eligible to get the vaccine. And as we speak, Santa Clara County's website for vaccination appointment is being revamped to allow everybody from 16 and above to get the website. So check back this evening, please check back this evening at sccfreevax.org. I'll put that in the chat as well. Please check back later this evening, and we'll be opening up to get yourself registered. And so please take advantage of that. And I'll turn the mic back to Wendy. Thank you very much for being here tonight.
Thank you, Supervisor Lee. Now I'd like to turn it over to Casey Deschamps, who is our Congressional Liaison for FEMA in Region 9. Really happy to have Casey here this evening to give us some updates from FEMA. And welcome, Casey.
Yep. Thank you, Wendy, and thank you, Congressman Khanna, for inviting me here tonight to be a part of your call. Again, my name is Casey Deschamps. I'm an external affairs officer. I work for the Federal Emergency Management Agency from our local office here in Oakland, California. And I'd just like to take a few moments here tonight to highlight some of the ways the federal government is supporting California through the President's COVID-19 response plan. In alignment with President Biden's plan to respond to COVID-19, FEMA is working with other federal agencies to coordinate with state, tribal, and territorial authorities and private sector partners to assist, augment, and expedite vaccinations in the United States. One way FEMA is providing vaccination support is through the establishment of community vaccination centers. We were fortunate in California on February 3rd, Governor Newsom and the Biden-Harris administration announced a project to establish 2 large-scale community vaccination centers, one in Oakland and one in Los Angeles. The goal of establishing these 2 joint federal pilot sites was to expand the rate of vaccinations of California in an efficient and effective and equitable manner, with an explicit focus on making sure that communities that have been hit hardest by COVID-19 were not left behind. This 8-week pilot mission concluded yesterday, but these 2 sites still remain open and under local leadership. Another way the federal government is supporting vaccinations is through the federal retail pharmacy program, which we heard just a little bit earlier tonight. This program provides vaccine to national pharmacy partners and independent pharmacy networks across the country. This program is being implemented incrementally based on the availability of vaccine supply, with select retail pharmacy locations providing COVID-19 vaccine to eligible individuals. As vaccine becomes increasingly available over time, this program will expand to ultimately include over 40,000 pharmacies. The federal government is also providing vaccine through federally qualified health centers, with the goal of ensuring our nation's underserved communities and those disproportionately affected by COVID-19 are equitably vaccinated against COVID-19. And then lastly, the federal government has partnered with dialysis organizations to enroll as COVID vaccine providers and increase access to dialysis patients starting March 29, 2021. And then lastly tonight, I'd just like to touch on the funeral assistance program that FEMA is now offering from the Coronavirus Response and Relief Supplemental Appropriation Act of 2021 directed FEMA to reimburse individuals who incurred funeral expenses related to COVID-19 that occurred from January 20th, 2020 and onward. And I'm pleased to announce that today the program did start off. To be eligible for COVID-19 funeral assistance, an applicant must be a U.S. citizen, non-citizen national, or qualified alien who incurred funeral expenses after January 20th, 2020 for a death attributed to COVID-19. This assistance is limited to a maximum financial amount of $9,000 per funeral and a maximum of $35,500 per application. The Funeral Assistance Center call center is now open from 6 a.m. to 6 p.m. Pacific Daylight Time, Monday through Friday. The number that applicants can call to register is 844-684-6333. And don't worry about writing down that number. If you didn't get a chance to write that down, you can access that number by visiting our website, which I'll give you our website here at the end of my presentation. When you call to register for funeral assistance, it's a toll-free number, and you'll speak directly with a trained representative who will guide you through the funeral assistance application process. Because this is a new program and today was our first day, we experienced quite a bit of calls and traffic to our call center, and which caused some technical issues. Some of the applicants were reaching operators while others were receiving a busy signal. We're asking that applicants be patient and work with us as we correct these issues. And please know that there is no deadline to register and there is no limited pot of money for this. So anyone who is eligible to receive COVID-19 funeral assistance will receive COVID funeral assistance. There's no urgency to register right now. So don't feel as if you have to register before the money expires. That certainly is not the case. We will not rush through calls because we intend to make sure that every applicant gets their questions answered and receives the help they need to apply for. And so to find out more information about our funeral assistance, please visit our FEMA website, and that address is simply fema.gov. And when you go to the website, if you'll go to the search engine and just type in funeral assistance, it'll bring up our funeral assistance landing page where you can have more information about how the program works. There's an frequently asked questions section, as well as the official policy stated there. So I'll stop there and we'll stand by for any potential questions. Back to you, Wendy.
Great. Thank you so much, Casey. I didn't know about the funeral assistance program, so that is really wonderful information we should be spreading to the community. And as Casey mentioned, information about the program is on the FEMA website, fema.gov, and I'm sure that 800 number that Casey mentioned will also be listed on that site because I wasn't quick enough to write it down. And again, if you have any questions for any of our speakers, please kindly enter them into the Q&A box on the bottom of your Zoom control panel. If you're watching us on Facebook, just go ahead and put your questions into the live comment stream, and we'll make sure that they get entered into the Zoom Q&A function from one of our wonderful team members this evening. All right, so our last speaker this evening will be Dr. Marty Fensterscheid. He is the COVID-19 testing and vaccine officer for Santa Clara County, and we somehow coaxed him out of retirement to come back and help us spearhead our testing and vaccination efforts here in Santa Clara County. Welcome, Dr. Fensterscheid.
Thank you very much for inviting me to this, and thank you to all our legislative leaders in our community that have helped so much during this effort. So yes, I did come back. I retired. I thought I was good for retirement, but I failed at retirement and I am back. I was honored to be asked to come back and help out with the effort. So let's begin. I'm going to give you, although Supervisor Lee did a great job, I thought he would just take over these slides and present my outline, but I think you did a great job. And I'm just going to reiterate a number of the things you said and give some more data specifically. So let's just start with our first slide, and I'll just go through it rapidly through this deck. So as was mentioned, again, we do have now 3 vaccines that have been authorized by the FDA. We have Pfizer and Moderna vaccines that have been around the longest. They require 2 shots. The Pfizer vaccine requires an interval between the shots of 3 weeks, and the Moderna vaccine 4 weeks. And then the Johnson & Johnson vaccine, which is just 1 dose, and you're done. So that's the advantage of that. Next slide. So there's a lot of words on this slide, but basically people were concerned because it seems like the vaccines were developed so quickly. But there were a lot of reasons that it was actually done as quickly and as efficiently as it was. No steps were skipped, and the researchers used all of the networks and trials that they typically do. They have to go through a phase 1, 2, and 3 trial. The other thing that moved things along quickly is that the manufacturers were actually making the vaccine as the various trials were ongoing. So unlike usually when the trials then finish, the vaccine manufacturers just begin making the vaccine in large quantities. This time, basically, they were standing by. As soon as the authorizations came, the vaccines were shipped. So we were able to do it much quicker than typically occurs in some other vaccine trials. So no steps were skipped. They're all safe and very, very effective. Next slide. And this basically just shows the a little bit of the comparison between the authorization trials of the 3 vaccines. I mentioned already the 2-2-1 and the number of doses for those 3 vaccines. The Pfizer and Moderna uses a certain technology that allowed it to be manufactured pretty quickly. Most of the trials were done on people in the United States. And the Johnson & Johnson vaccine was more expansive. It was done in several countries around the world. There's a breakdown there. Now, those numbers there are just basically saying what percentage of racial and ethnic individuals were included in the trials. That's basically how they basically tried to include as many different racial ethnic groups to be inclusive in the trials as they went along. The protection against hospitalizations in all of them is 100%, and the protection against dying from COVID is also 100% in all of these through the trials. The Johnson & Johnson vaccine, some people have said, well, you know, I heard initially that the effectiveness was a little bit lower. Well, the Johnson & Johnson vaccine was actually in the process of being evaluated and occurred this evaluation around the world, and it was up against some of those variants that we were talking about, especially in South Africa, and it did quite well. So that basically affected a little bit of its efficiency, but again, it's just as effective, just as safe as all of the vaccines. So any of them is the best vaccine, any of the ones that you're offered. Next slide. And again, the vaccines require a little time to take effect. So after you complete either your 2 doses of Moderna or Pfizer, depending on, again, 3 weeks or 4 weeks apart, you need to still wait an additional 2 weeks after you finish that final dose for it to become totally effective. And after the Johnson & Johnson, which is just 1 dose, you have to just wait after the 1 dose, you just wait for the 2 weeks, and then they will be fully effective. Is it possible for someone to get infected if they basically have been just vaccinated? If you were infected with the virus just before you were vaccinated, as I just mentioned, it takes time for the vaccine to take effect and be fully effective. So you potentially could have been infected early on before you had the benefit of the vaccine taking effect. And so you could actually be infected. And that's usually the issue as far as being infected and having received the vaccine. And then the person, of course, has potentially to get some symptoms or become sick after getting that vaccine, thinking that perhaps it was the vaccine. The vaccine does not cause an infection. You cannot get COVID from the vaccine. The side effects of all of the vaccines are pretty common and usually are very mild and short-lived. When I had mine, I had a kind of a sore arm and maybe a low-grade fever for a day or so, and it went away. And that's usually what we see. Very few contraindications of getting vaccinated. We ask people basically say, well, you know, I have allergies. I have food allergies. I have allergies, seasonal allergies. It doesn't matter. All of those conditions really are not contraindications for getting vaccinated. Even if you have been infected with COVID itself, you should still be vaccinated. And the reason is because the natural infection, the immunity that you get just from being infected is probably not as good as the immunity you get and derive from actually getting the vaccine. So no matter what, you should be vaccinated. Next slide. And why are we doing this? People may have read or heard about herd immunity. Basically, this is just a quick overview. Early on, we had no vaccines. And so basically, we all had to wear masks like I'm doing here at work and get tested and socially distanced. We then began getting some vaccines, starting in December. And even to now, as mentioned, we are not fully vaccinated. So that's why we still have to use our masks, wear our mask, stay socially distant, and also please get tested. Our numbers of testing that are people getting tested has dropped over the last several weeks. It's still a very important tool while all of you are waiting to get your vaccine appointments. And then finally, once we are widely vaccinated as the community, as a nation, where we are hopefully beyond 70, 85%, then basically the virus has no more susceptible individuals to transmit to. And so the vaccine hopefully will allow us then to begin easing up on these prevention measures. But I think the message right now is that don't let down your guard, continue to be vigilant, at least for a while longer until we can get a lot more people vaccinated. And as you heard, with more vaccine coming from the government, we should be seeing a lot more people getting vaccinated. So when your turn comes, please go and get vaccinated. Next slide. And right now, and this is in the state, as we've mentioned already, we've gone through a lot of eligibility criteria. We just on April 1st opened it up to individuals 50 and older. And now on Thursday, the 15th of April, statewide, anybody 16 or over will be able to make an appointment and get a vaccine, 16 and older. I would mention also, though, one caveat here is that the Pfizer vaccine has been approved for those that are 16 and older. The Moderna is 18 and older, as is the Johnson & Johnson. So if you are 16 or 17 years of age, you will have to be vaccinated with the Pfizer vaccine. But there's plenty of that, and hopefully a lot more to come. So look for Thursday. We're very excited about opening this up to the all eligible persons. Next slide. And as Supervisor Lee mentioned, this is how we've been doing since in Santa Clara County since we started vaccinating our first person on December 17th. The blue bars show the daily numbers of first doses we've given, and the green bars are showing the second doses that people have gotten. So you can see we started out with a lot of first, and then began after those intervals, we began doing the second doses. The pink bars represent the single dose of Johnson & Johnson. And as was mentioned, we are at about 47% of everyone that's eligible having received at least one dose of vaccine, and over a quarter of the population eligible having completed their vaccine series. Next slide. And I know as a great concern of all of us is the equity and disparities that we are seeing all over the country. We are working very hard to close those gaps. But you can see here in the various age groups, the first one being everybody that's eligible, 16 and older. We've done, as we mentioned, 750,000 people having received at least one dose, the average 47%. But look at the breakdown by race and ethnicity, and you can see some are doing better and some not so well. We are working very, very hard to outreach into the hardest hit areas, especially in the Hispanic Latino areas of the east side of Santa Clara County and South County. Also the African American community. Also, we're trying to push for additional input and additional outreach into the communities most affected in those populations. And then you can just see, I won't go over the slides or the numbers, but the 50 and above, also the same disparities are there in the Latino population and in 65 and older, although we're doing very well in getting almost 3/4 of the 65 and older population at least one dose of vaccine. Let's move on. And again, we've talked about this, but allocations have been continued to be inadequate. We have had much more demand than supply. We are hoping, as we've discussed already, that with the vaccine coming directly from the federal government to the special clinics, the FQHC clinics, that we will see a lot more vaccine coming to our communities that we can address again into the hardest hit populations. So we hope that will alleviate a lot of the issues around supply. But just to give you an idea, we're only at about 1/3 capacity right now. So we just need the vaccine. And again, the more vaccine we get, the more work we can do to close those equity and disparity gaps. We also can't forget that people have some vaccine hesitancy also, meaning that some people just don't want it for many, many different reasons. And we're all working very hard to display all of those myths and issues that people are, people have heard that are not necessarily accurate about the vaccine. So we have to deal with various community beliefs. And the best way of doing that, of course, is working with community leaders and going into the communities to basically talk about those issues and answer those myths with valid and very effective information. Next slide. As you saw before, when I was showing those various racial and ethnic breakdowns, it said Asian groups. And we know that Asians alone represent a number of subgroups, and data sometimes gets lumped. So we did our best to disaggregate or break down some of those subgroup numbers. And I have a little bit of those numbers. Next slide. So when we looked at all the individuals who had indicated that they do fit into the category of Asian. And then when we actually look at the subcategories, we find that 1/4 of the population, Chinese, that are in our community have been vaccinated with at least one dose. The same for Filipino and the Indian population. However, the Vietnamese population has done somewhat better, and that 50% of the eligible Vietnamese population have been vaccinated with at least one dose. Next slide. And again, it was mentioned that we were undertaking a large mobile vaccination effort because we know that we have to bring vaccines to communities. We can't expect communities always to come to us for many, many reasons, but our mobile vaccine efforts include mobile units that are going to skilled nursing and long-term care facilities. We also have a program for in-home vaccinating for people that just can't get out for whatever reason. I have a number up there and a website so that somebody who feels that they or know a family member or friend needs that service, that they should contact us to set that up. And again, setting up sites in various neighborhoods and high schools, community centers has been our effort, again, the ongoing effort to deal with the gap and disparity issue. And then we've also gone to actually work-based areas such as farm worker and agricultural sites such as Monterey Mushroom, where we've been several times down in our South County area. Again, knowing that a lot of the workers don't have the time to actually get in to be vaccinated. And I think that might be our last slide. Yes, it is. So I'll stop there. Thank you for the opportunity.
Thank you, Dr. Fensterscheib, for that very comprehensive update. I'm always astounded to see the lengths that our county is going to vaccinate its residents, and that is really just testament to your leadership. So thank you, Dr. Fensterscheib, for that overview. Now, I want to turn it back over to our hosts to see if they have any reactions to anything that either their colleagues or our panelists shared this evening, comments or questions, reactions. And so I'll open the floor to our gracious hosts.
Well, I just want to thank Dr. Fensterscheib for his excellent presentation, and just thank all of the panelists for their work and their leadership in being so thorough and being so knowledgeable. It's really a place where we care about science in this county and in Santa Clara and Alameda County, and I'm really proud of the work everyone's doing and the residents. And you know, our task is to try to get as many vaccines as possible to the state and local government, and we'll continue to work on that.
Go ahead. I don't have anything else to add. I think it's we're still doing the work. Doctor, thank you very much for coming back out of retirement. It's good, and it's also I think the FEMA guy, these mobile units are going around. I'm not so certain about how they've gotten into Santa Clara, but I know I was with the governor in Hayward at one of the Office of Education, that they were going into different churches and community-based groups. So I don't have a list of where they've gone into the mobile units into Santa Clara, but it's happened.
Casey, do you want to respond to the senator's inquiry about whether or not there have been mobile units from the federal government that have come into Santa Clara County?
Sure. Yeah, I apologize. I wasn't sure if you wanted me to respond. So yeah, so we on the 2 community vaccination centers that we had established, the one in Oakland and then another one in Los Angeles, there were mobile vaccination units associated with those 3 sites, but I don't believe they had gone as far south as into your area. So those mobile vaccination sites that you saw were probably either run by the county or another local entity.
Thanks, Casey. Supervisor, any comments, reactions, questions for either of our panelists?
Yeah, thank you so much, Wendy. And just really great to see some of the answers on the chat and the questions as well. And thank you for all those attending, asking these questions. I saw Senator Wieckowski answer the question regarding the businesses, regarding trying to get 2 years in business and the tax return requirements. So thanks for responding to that. And I think there's also another question too regarding the potential of a vaccine passport that was being mentioned there. I've heard that President Biden has mentioned that there was no plan of doing a federal vaccine passport, but or just some type of verification system, other than us having this, CDC card when we get the vaccination being done. Congressman Khanna, do you have any more information that you might know regarding any type of verification we'll be doing that might aid the international travel, so that people will be able to open up sooner and get to different places? If you've heard anything.
I know that obviously under the federal law and state law, as I understand it, local employers and local school districts, it can require vaccination as a prerequisite for attending or participating, absent specific religious exceptions, and that's just the vaccine law. I don't think, and nothing I've heard that the Biden administration is going to go beyond what employers and counties and states are already able to do. I'm sure where it comes to the interstate activities like airlines, we will work with the airlines, the FAA will on appropriate regulations. But this is something that people should know is already the law. It is the law allows for employers and states and localities to make that decision within reason, as long as they're accommodating particular religious beliefs.
Thank you, Representative Khanna. All right, so we do have time for a bit of Q&A. I know Senator Wieckowski was very busy during some of the panelists' presentations answering some questions, but I do want to elevate a couple that have come in. And again, if you haven't had a chance to ask a question, please drop your question into the Q&A box on the bottom of your Zoom control panel. And if you're viewing us live on Facebook, please enter your question in via the live comment stream, and a member of our team will make sure that it gets submitted via the Q&A function at the bottom of the Zoom control panel. So Santa Clara County Board of Education trustee Kathleen King asked, well, obviously a number of schools are starting to reopen, and the mental health of our students as they're going back to school is of grave concern. Any update on funding to help? And Senator Wieckowski, you did type a response, but I was hoping that you could elaborate about some of the state funding that is available for school districts for counseling and other mental health services. Senator?
Well, some of the money that we got from the federal government, thank you, Khanna, and we combined it for our $7.6 billion package. A large portion of that was for the schools, and there was incentives for schools that went back before April 1st, and then up till as school goes in. So if schools are going back now, they get some assistance. If they don't get that portion of the to go back. They do get stuff for cleaning and other protocols when they go back in the fall. Some of the money that was there to assist students, there's some mental health money that's in there. There's some additional funds that are there for the school districts to apply. So that's, I think that was the question. What is there some help with the students? It depends on it's available, and it's a formula that the schools have.
Great, thank you for that, Senator Wieckowski. This is a question that came in through our registration for tonight's town hall, and this comes from Stuart from, I believe, San Jose. Stuart runs a youth basketball organization for about 7,000 kids in grades 3 through 8 in Sunnyvale, Mountain View, and Los Altos. The program's been shut down for a year, but they hope to start up again in the latter part of the fall. And he asked, the county has often deferred to the state when he's asked about requirements. He would like to know a little bit about what is the process for deciding restrictions and when to lift them. Is there a central place for information where parents and other individuals can get information about updates related to youth sports? And then just generally any updates on a timetable for youth vaccination for children younger than 16. So I'm not sure who can speak to that, but that is a question that has come in from Stuart.
Well, I can speak to the under 16. The Pfizer Corporation right now has been doing trials on the 12 to 15-year-olds, and they have already requested some for the FDA to consider their the study data that they have accumulated, and hopefully that will be coming in front of the FDA in the next couple weeks. They're asking for an amendment to the authorization that they already have for their Pfizer vaccine. And if that's approved, after the FDA looks at the data and CDC approves, then they would open up, they could, again, it's the same vaccine. So we would open it up and then to individuals 12 years of age up through 16. So we're hoping that will actually come through within the next few weeks.
Yeah,
go ahead, Senator, please.
I don't know on the conventions they have. We know that when we return to normal or full resumption of operations, the health restrictions will apply, masking and those guidelines to conventions and those type of activity that they were doing. You could either have to test or you have to show proof of your vaccination, and up till 5,000 people as of October 1st. So there's going to be, you still have to follow the health care or health advisories, but if it's less than 5,000 people, that's all you have to do is follow, mask and do the testing.
Great. Thank you for that, Senator Wieckowski. We've got a question that's been submitted from an anonymous attendee. They ask, among which populations in Santa Clara County are you seeing the greatest vaccine hesitancy? Or is it too soon to really say? Dr. Fensterscheib, any insights here?
Yeah, it's a little too soon to see exactly which populations, but any of the populations that we have done some intensive work with and gone into communities, we found vaccination hesitancy in all of them. So I wouldn't say just one of those populations. Everybody has questions, and everybody, including people, officers in the jails, people in various communities, workers, students, everybody has some issues potentially that probably can be solved with some better education. So we're working on that to try to dissuade them from thinking that that information is true.
Thank you, Dr. Fensterscheib. I know our office has gotten a lot of questions from small businesses about relief programs they may be eligible for. And I know Senator Wieckowski was gracious enough to put some information into the Q&A box around the state's small business relief program. I was hoping that between Supervisor Lee and Senator Wieckowski, you might be able to provide some insights around small business relief for budding entrepreneurs.
Supervisor, why don't you go first and I'll fill in the blanks.
Sure, absolutely. So from the county perspective, we have done a few things, one of which is the waiving of the business tax for a lot of small businesses, along with the weight and measures fees that many of the grocery and retail actually has for the small businesses. That just passed this past Tuesday. The county also have come up with a small business loan program, initially funded with $6 million and then later on with $19 million of low interest loans to be allowed for up from $5,000 to $100,000. These are the small loans for the small businesses, basically to help with the cash flow. And it's really exciting that this is something the county has done, but certainly we're not doing enough. And I really do think that the help, whether it's through the federal government, like the PPP, the EIDL, and now just passed it to Senator Wieckowski to talk about the state programs that you're giving for small business as well.
Yes. So there's you have to pay licensing fees. If you're a bartender, you sell, not a bartender, but a bar or restaurant, you have fees that you have to pay to the ABC. Those are waived this year and next year. So for 2 years, you don't have to pay that $1,000 or something like that. Also for barbers, hairstylists, fingernail salons, that type of stuff. For 2 years, we've waived those fees. We have a loan program. So a loan, we don't have a loan program. We have a grant program. So the idea is we had a first batch of 500,000. Now we have other other batches for folks that they could be out of business, but plan to go back into to business, but they had to be, doing business as of June 1st, 2019. It's an arbitrary date that we came in, but if you were doing business in there, you're eligible for either a $5,000 grant, a $15,000 grant, or $25,000 grant, depending if you're less than 100,000, between 100 and a million, and then a million and a 2.5. So that's on the calreliefgrant.com. And it's in 17 different languages, and it's designed for self-service that people can go in. Obviously, if you got a question, you can contact my office after this.
Great. Thank you for that, Senator Wieckowski. And we're just about out of time. And I know Congressman Khanna actually had to step off the town hall for a very urgent call. And so we've exhausted most of the questions that we've received either by through the registration or through the Q&A portal this evening. So I'd like to turn it back to Supervisor Lee and Senator Wieckowski for any closing remarks.
Well, first of all, I'm truly honored to be here with Dr. Fensterschreiber, who is doing amazing work of providing the vaccination ramp up that we have. And all the good news that I've been talking about really is under his leadership, along with Dr. Cody and many of our county team putting all this together. So I've been hearing, really good feedback from folks who've gone through either the fairgrounds or many of the sites of House Move, where everything is. So I just want to say a huge thank you for our county for all that extra lift that they have done. And I want to say thank you to Senator Wieckowski and also Congressman Khanna for their work at the state and federal level, because it really takes everybody, the federal, state, and local government working together to get us through this COVID thing. It's been over a year, but I would say that, yeah, clearly we're here at the point where we can see a light at the end of the tunnel. And besides getting the vaccine, what I'm telling people is don't stop wearing those masks, keep wearing those masks, right? Washing hands and keeping a social distance, but that mask absolutely will help save life and, gain our freedom back, basically. And I'll turn that to our Senator for the last word.
No, I'm delighted that I was invited and you allowed me to participate. I mean, we all know that this virus has not affected everybody the same. Some people have weathered it quite well, and others, their businesses have been devastated, their health, they've lost loved ones, and it's taken an emotional toll on all of us, besides an economic and a health toll. But these horrible situations force government leaders like the federal government and the county and the state to come together and work as partners and try to deliver services and, as you say, get people to the end of the tunnel. We're in the tunnel still, and some people it's agony every day. So be vigilant. The numbers are looking so promising, and we're optimistic. But as the members of the panel have said, keep your mask on, keep social distancing, and don't put your guard down quite yet.